Health intersects with many other departments. That's why this piece of work is really important, because I think there are a lot of learnings that will go across the system, but also outside of health too.
Criteria-led discharge is a multidisciplinary approach to ensuring that patients are able to go home as soon as they are well enough. A criteria was set by the senior clinicians. That criteria was then used by the junior medical officers, nursing staff, to make sure if the patient reaches all the criteria, they could then go home safely.
So I'm an Associate Clinical Services Coordinator here on Ward 5D at Flinders. Patients are extremely happy with the process. I personally have discharged a few patients with criteria-led discharge, and they've been very happy that they can go home when they're ready and not have to wait around.
And that was one of the core goals of criteria-led discharge, was to value the patient's time. There would not be a corner of Flinders Medical Centre that hasn't been touched by redesigning care.
Because in health, change isn't something that's new, so what we're used to doing is continually reviewing what we do. It's about initially engaging staff, because at the end of the day, if the behaviour of the people working within the system doesn't change, then nothing's changed.
It's empowered the nursing staff who are accredited to do it to further educate and discharge the patients in a quicker, more timely manner than what they had been waiting for the medical staff.
Criteria-led discharge isn't taking any of the decision-making away from the medical officers where it has historically sat.
We need to make sure that if we're doing this, that the patient journey isn't jeopardised within that process. And my sense is at this stage that it's as good, if not better, than a registrar consultant-led discharge process.
The 90 days really allowed many of the clinicians in Flinders and those involved in the 3 pilot sites at Flinders to focus all their energy for 90 days on achieving really good outcomes for our patients. Change at SA was crucial at the start to provide a framework and to guide how we were going to approach criteria-led discharge across the organisation.
I'm particularly delighted that we're one of the lead projects. I think that the people, Jason and the team, have done a marvellous job, and I think for Flinders this is a really good thing.
What we've found, certainly with Flinders Medical Centre, is some really, really innovative and passionate people who actually know what needs to change. It was not hard for health to find where the improvements could be. All we needed to do was give them the platform to do it.